Hello, and welcome to Nursing Research Tips, a show dedicated to sharing best practices, tips, and other resources within the areas of nursing research and evidence-based practice. I'm your host, Jenny Barrow, Associate Professor of Undergraduate Nursing, who specializes in teaching students real-world content to help transform their future nursing practice. I enjoy taking the boring world of research and EBP and making it come alive for my students, and that's what I intend to do with this podcast. On today's episode, I have some special guests from my university's undergraduate nursing research and evidence-based practice course. Allison Bartlett, Trinity Ellender, Caitlin Hardwick, Caitlin Odom, and Sydney Packard are joining us to discuss their evidence-based practice project. Before they get started with their discussions, though, I want to let our listeners know that I have shared a copy of the students' EBP poster that accompanies this podcast episode. You can find this resource in the show notes for today's episode in whatever podcast player you are currently listening to. Now, without further delay, let's turn the show over to Sydney to get us started.
Hello everyone, my name is Sydney Packard. On behalf of my other group members, Caitlin Hardwick, Trinity Ellender, Allison Bartlett, and Caitlin Odom, we'd like to welcome you to our podcast. We are all undergraduate nursing students at McNeese State University in Lake Charles, Louisiana, and today we'll be discussing the work we have completed throughout the semester in our nursing research and evidence-based practice course. The title of our presentation is Nursing Interventions and Anxiety in Adolescents Related to Social Media Use. The reason we chose this topic is because we have observed an increasing amount of adolescents using social media. This is coupled with an increase in anxiety and depression among this demographic. Looking back to the times when we were adolescents, we didn't experience these issues. While social media did exist during that time, it was brand new. Many of us did not participate in social media until we were older and understood the implications. As future nurses, it is important for us to understand the struggles that our patients are experiencing. These struggles not only affect adolescents, but the people around them. Knowing the cause allows us to create an effective interventions to combat these issues and better care for our patients. Addressing the issue early helps to lessen the chance of continued problems as the adolescents grow up.
Thank you for introducing your team to our listeners, Sydney. We may have some pediatric nurses, some school-based health nurses, or even some non-nurse parents of adolescents who are joining us for this episode today. So I think they will find your group's discussions insightful. With that being said, Sydney, can you tell our listeners a bit more about why your group feels this topic is important?
I will now share with you my group's problem statement. Social media has been around for a long time and continues to get bigger and bigger. Many people today use social media to keep themselves up to date, whether it be to see posts from their family, keeping up with long-distance friends, or even chatting with new people they've never met. With that being said, social media in the wrong hands can do more harm than good. Adolescents are a great example of this, as they are known for being easily influenced. They may think because they're behind a screen, there will be no true consequences for their actions. Social media can take a toll on this easily influenced age group, giving them newly found insecurities and comparing their profiles to others, all resulting in the same outcome: anxiety. Social media usage and Developmental of Psychiatric Disorders in Childhood and Adolescence, a review, states, in social media, where the rationale component is strong, anxiety can derive from a perception of being connected inappropriately, from negative online peer comparison, or from reduced emotion regulation abilities, as online interaction can be used as a surrogate for offline physical interaction. This shows many adolescents struggle with anxiety disorders resulting from social media, and they must apply specific interventions that will help them properly cope through this.
Thank you for explaining some of the key background information about some of the negative aspects of social media use in adolescence, Sydney. As a mom of twin daughters myself, who have had their ups and downs with social media over the years, this is a hard road to navigate from the parent's perspective, especially in light of the importance of the peer group developmentally on children of this age. As nurses, if we understand possible linkages between social media use and negative mental health outcomes in this particular population, we could provide evidence-based education to families to help them be more informed. So now, Trinity, can you tell us what your group did next within the process of this overall evidence-based practice project?
Now that we've established the significance of this evidence-based practice topic to the nursing profession, I want to share our group's evidence-based practice question with our listeners. Our question that guided our literature search on this topic was, what is the effect of interventions on improving mental health outcomes in adolescents impacted by social media use? And we crafted our evidence-based practice question in the PIO format, which includes our populations, so that would be our adolescents impacted by social media use, our interventions, which would be mental health interventions, such as educating parents and patients on signs of worsening depression and teaching them more effective coping skills, and outcome. We wanted to see an improved mental health outcome. This could be reported improved coping skills or patients reporting less anxiety and depression altogether.
Thanks for sharing your group's PIO question with our listeners, Trinity. This question served to focus your group's investigations into the literature. So, can you tell us more about how you used the PO question to help you find published research studies about your group's selected topic?
We used our group's PIO question to develop targeted keywords for searching reputable library databases. This includes the University of Kentucky's uKnowledge, PubMed, Biomed, and we also had 2 from the Journal of Medical Internet Research. Some of the key terms we used in our searches included anxiety and social media and anxiety and adolescence, coping skills, anxiety and interventions, digital stress, and psychological well-being. To refine our search, we applied specific limiters such as the publication date needed to be within the last 5 years. This is to ensure the most recent research. So this means it needed to be published between 2020 and 2025. The language needed to be English, it needed to have a full text, and it needed to be peer-reviewed. Throughout our search, we found that using Boolean operators like and or helped broaden or narrow our results efficiently. One challenge we did encounter was filtering out studies that focused only on general adolescent mental health without a direct connection to social media. To overcome this, we adjusted our keywords and used subject headings specific to each database. For a more efficient literature search, we experimented with different keyword combinations and used database filters strategically. By refining search terms and applying appropriate limiters, we were able to locate high-quality studies relevant to our topic.
I appreciate your sharing some helpful insights into your group's literature search process, Trinity. Some of our listeners may have never heard the phrase digital stress that your group mentioned as a possible keyword in your searches. Digital stress was first called techno stress by Broad in 1982. So this idea has been around for multiple decades. More recently, in 2014, Weinstein and Selman developed a heightened understanding of digital stress from a thematic analysis of about 2,000 anonymously posted personal narratives from adolescents. They discovered that there are 2 distinct types of digital stress that were identified by these adolescent respondents. Type 1 stressors relate to bullying, drama, and harassment within the context of online relational hostility. Type 2 stressors are more related to the stresses of adolescence and just trying to be present and build and maintain meaningful digital connections with others. It's about the presence of being online and being there frequently enough to have a digital presence. I've included a resource for further reading linked in the show notes for this podcast episode if our listeners are interested in learning more about digital stress as it pertains to your group's evidence-based practice poster project. Now, After your group reviewed these retrieved peer reviewed studies, what key evidence did you discover pertaining to your group's original PIO question that you mentioned earlier?
For the key evidence of this research assignment, my group has collectively conducted a literature search incorporating previously described methods to cover the basis of our EBP question. By sorting through each article to find high-quality studies that correlate to our question, each member of this group was individually assigned to sort through these articles and discuss ways these studies correlated to each other. Then the discussion was critiqued by other members of the group to find the most accurate studies to put into the group synthesis table, demonstrating how the science behind these articles connects to the topic of what the effects of interventions on improving mental health outcomes in adolescents impacted by social media use. For starters, all the reviewed studies show higher social media usage is linked to increased anxiety, depression, and stress, meaning the more time that these individuals spend on social media, the more their psychological vulnerability is heightened. Another example found in Mabezo, Nazi, and Yu's articles is that frequent posting is more strongly associated with negative mental health outcomes compared to passive scrolling. This suggests the pressures of content creations, social validation, and engagement by followers, including likes and comments, will likely increase the stress and the individual's self-doubt. According to Lottie and Mabezo's studies, adolescents with active parental guidance and restrictions report lower rates of anxiety and depression. In other words, when the parents monitor and reduce their adolescents' exposure to the internet, their children's mental health tends to have better outcomes. The articles of Catlett and Lottie discover temporary reduction in social media can improve well-being, but the long-term effects are unknown. The participants in these studies stated when they temporarily disengaged from social media, they felt less stressed and more present in their lives. Catlett, Lottie, and Mabezo's articles noted that adolescents with public social media accounts experience higher levels of anxiety and depression. This is likely due to the increased exposure of online scrutiny, cyberbullying, and a heightened need for social approval. Public accounts can amplify all these, making adolescents more susceptible to external validation-seeking behaviors and negative self-perceptions based on online feedback. Nazari and Yu's articles point out late-night social media use contributes to poor sleep quality, resulting in worsened mental health. Exposures to blue light from screens can interfere with melatonin production, delaying sleep and reducing sleep duration. Also, engaging with stimulating or distressing content before bedtime can increase emotional arousal, leading to impaired sleep and overall well-being. Mabezo and Yu's articles reveal viewing idealized images online can result in body dissatisfaction and low self-esteem. There are many platforms that prioritize aesthetic perfection that contribute to unrealistic beauty standards, fostering negative self-comparisons and increased vulnerability to appearance-related anxieties. These effects are more vulnerable to adolescents who are in critical stages of identity development and self-perception.
Excellent discussion of the studies that your group reviewed, Kaylin. I appreciate that you explained some of the correlations you found across multiple studies related to the frequency of social media use, the frequency of social media posting versus scrolling only, and the importance of parental oversight throughout the entire process. I also thought it was interesting that your group found information about late night computer use and blue light exposure and as those relate to sleep impairments. I had not originally thought about that in connection with your group's overall topic area. Now, Allison, can you tell our listeners about some additional key implications that nurses who work with adolescents and their families across multiple different care settings should consider based on the literature that your group reviewed?
Based on the information our group reviewed, we noted some synthesized implications for nursing practice. Education and prevention seem to be the easiest ways to help this, so we would suggest nurses to educate adolescents and parents on the possibility of social media having a negative impact on mental health. We would suggest them provide adolescents and parents with a pamphlet on the signs and symptoms of worsening mental health like depression and anxiety. We would educate the parents on the importance of parental guidance and monitoring for social media. We would encourage the adolescent to set limits on social media screen time in their phone, and we would encourage adolescents to be mindful when scrolling and posting, which would include asking themselves, what is the purpose or the goal of their social media use at this time? What is this doing to your mood or your self-esteem? And how long are you spending on social media each day? Encouragement in this case doubles as prevention. Education and prevention gives the parents and adolescents food for thought that they can go home and reflect on, and that will, in a way, bring a new sense of self-awareness. Since mental health is completely subjective and is not something you can exactly do a blood test for to get a diagnosis, an increase in self-awareness and the opportunity for reflection gives people the power to be able to detect these changes within themselves and notice the changes in others so that they know when to seek help and when they need to take action and cut back on their social media use. The suggestions could potentially benefit nurses in psychiatric care facilities and in clinic settings, since these are common places for concerned parents to bring their children in when they suspect that they are struggling with mental health.
Thanks, Allison. You provided our listeners with some helpful takeaways for how nurses can educate adolescents and their parents about some of the social media related mental health outcomes. So, Allison, did your group find that there are any gaps in the present literature that may require further research studies?
There are still some knowledge gaps remaining in the published literature surrounding the effects social media has on mental health. Therefore, our group did develop some implications for future research. Future researchers may consider narrowing research down to just one specific social media platform. We thought narrowing it down to a specific social media platform would be helpful in determining if this applies to all social media platforms or if there are certain platforms that affect adolescents' mental health, like TikTok or Snapchat or Instagram. We also thought research could focus on determining what parts of social media use leads to increased depression and anxiety in adolescents. Focusing on exactly what is going on would provide important insight on whether this is a response to cyberbullying through mean comments, or if this is an issue related to missing out, being left out, or comparing physical appearances to others. This would allow nurses to provide better education to the parents and their children on the impact social media has on the mental health of adolescents and would help nurses and providers create better care plans for these children.
Okay, so your group has given us a lot of excellent information about the current state of the science surrounding your selected clinical practice topic. After all of the research studies your group reviewed, including any considerations for study weaknesses and limitations, and those continued gaps in the present literature you just mentioned, what was your group's overall literature-based answer to your original PIO question?
Hi, everyone, and thanks for listening. So, after reviewing several research studies, our group was able to draw an evidence based conclusion to answer our EVP question about how social media affects adolescents' mental health. The research clearly shows that while social media is a part of everyday life for teens, overuse can have significant negative impacts, especially when it comes to issues like anxiety and depression. We found that interventions such as parental guidance, education on healthy social media habits, and setting screen time limits can help protect adolescents from some of these harmful mental health effects. These strategies show a lot of promise, and that's really encouraging. But here's the thing. While these interventions can make a difference, the research also highlights that there's still a lot we don't fully understand. We need more studies to figure out which approaches are the most effective in the long term, because it's not a one-size-fits-all situation. Each adolescent has a different experience with social media. For example, we have some adolescents who use social media to glamorize their life on the internet, while others look up to those who use their social media platforms to glamorize life, and they compare themselves and may criticize themselves, which can lead to that anxiety and depression. So we have two different sides to social media, and we need to figure out what we can do to make social media a more positive place for everyone, not just one group of people. One of our biggest takeaways from this project is just how important it is to use evidence-based practice in nursing. By reviewing current research, we can make more informed decisions and recommendations that truly support the patient's well-being. And for us, as future nurses, being able to understand and apply research can make a real difference in how we advocate and care for our adolescent patients. This is a vulnerable population, so being able to advocate and care for them is a really important aspect of nursing. So moving forward, we hope that continued research will give us even better tools to help young people develop healthier relationships with social media. And as nurses, we'll be right there to support them, armed with knowledge, empathy, and evidence-based care. Thanks for tuning in.
Thanks for wrapping up your group's discussion, Caitlin. I'm proud of each one of you for integrating the content that we've discussed in our undergraduate nursing research and EBP course into a real-world literature search process. I appreciated that you brought out that adolescent social media use and experiences are not all equivalent. Therefore, nurses who work with this population must individualize interventions to best meet the teen where they are in their social media journey. It does seem that this general topic area has a lot of remaining research gaps, and those are going to require further research studies. Maybe if any of this group's members move forward to graduate nursing education after you complete your BSN, you could use this undergraduate EBP project as a springboard to further investigate this study in the future. We as nurses won't get the answers we need to fill in these important knowledge gaps without nursing researchers who inquisitively set out on creating and implementing these research studies. And then they must publish them to disseminate their findings for the rest of us to use. At this point, I would also like to thank our listeners for going on this journey with us. If you are a parent or a loved one of an adolescent who is struggling with when, how much, and what kinds of social media your child should be using, it's clear that you're not alone in these worries. If you worry that your adolescent social media use might be contributing to negative mental health effects, it's important that you discuss that with your child's mental health provider. As always, thanks again for joining us today.